The requests come from Scripps Health and Sharp Healthcare, which have facilities in Chula Vista. The San Diego Union Tribune first reported the facilities sent a letter just yesterday to the federal health and homeland security agencies. The hospitals say they're seeing more patients at their South Bay facilities compared to their other locations. Scripps Health CEO Chris Van Gorder says about half of its COVID patients and of Sharp's are at their Chula Vista hospitals.
So we know something's going on in South County. We know it has something to do with the border, not completely the border, but something to do with the border. And so we need action down there.
He says an estimated 250,000 Americans live in Baja California, and many regularly cross the border. In the April 28th letter, he and Sharp CEO ask for health screenings along the border and mandatory quarantine for suspected positive individuals. They're also asking for more personal protective equipment and other supplies. Van Gorder says Scripps can right now manage the 73 COVID patients it has system-wide, but he expects that to grow, especially in Chula Vista.
So we do think a significant number of those patients down there are crossing the border. Mexico, we know, is very challenged right now with COVID-19. Their hospitals are being filled up. They're running short on supplies. And I think there's a possibility that it could bubble over into San Diego. I mean, we're neighbors, we're close, we're friends. And certainly we have to be, ready for that.
Baja California's health secretary just yesterday asked for humanitarian support from Sharp in the form of doctors and nurses. A Sharp spokesman says the system is working with officials at all levels of government to see what help they can provide. Van Gorder says federal agencies have not yet responded to the letter for help from him or Sharp CEO, but hopes for a coordinated response in the border area. Tarryn, Mento, KPBS News.